October is Breast Cancer Awareness Month. According to the CDC, each year in the U.S., 240,000 women get breast cancer and 42,000 women die from it. Now, the American Cancer Society has the number of new cases for 2023 closer to 300,000. Here to talk about this is Dr. Elizabeth Morehead, a radiologist at the Breast Center at St. David's Medical Center. Thank you so much for joining us.
Thank you for having me.
Dr. Morehead, aside from being a woman, what are the main risk factors for breast cancer?
The risk factors are age, obesity. There are certainly family history risks. Ashkenazi Jews are more likely to have breast cancer genes as well.
When you talk about age, what age, the older you are, the increased risk?
Yes, that's right.
Okay, so women over the age of?
Over the age, I mean, it increases over the age of 50, over the age of 60, there's still more. Over the age of 70, there's still more. But I have to say that in my practice, I feel like I am seeing it in younger and younger women. And it used to be uncommon to see it in women under age 50, and now it's really not uncommon.
And again, breast cancer can be genetic. When is it recommended to get tested for BRCA1 and BRCA2 genes? Keeping in mind, though, that not everyone who has those genes will end up getting breast cancer.
Right. Well, first off, if you do end up having a biopsy that is positive for breast cancer, you would automatically be tested and your relatives would be tested. But if you have a strong family history, if you know of many relatives in your family, or particularly a male in your family that has had breast cancer, then you should seek the guidance of a genetic counselor. And there are also some ways to input your family tree in different risk model stratifiers on the internet that can help you determine what your risk factors are. And if your risks are high, but you don't have, even if you don't have the gene, you can consider having supplemental screening, such as adding breast MRI screening to your mammograms so that you're getting screened every 6 months. Each one's every year, but they're offset by 6 months.
What are some of the symptoms to watch out for?
A lump is number one, but there's also changes such as a change in size of your breast, puckering of the skin or thickening of the skin, retraction of the nipple, nipple discharge, particularly if it's bloody, and sometimes itching around the nipple.
What can women do to lower their risk?
The main thing is to get screening. The second thing is to maintain a healthy body weight and avoid alcohol consumption. Alcohol consumption is actually associated with increased risk of breast cancer, which I feel like not very many people are aware of.
Let's talk about the importance of early detection. And you mentioned screening, self-checks, mammograms. When should they be done, at what age, and how often?
The American College of Radiology recommends that screening begin at age 40 and occur yearly, which is what most insurances will pay for. You can always do self-exam at any time, and it helps because then you know what your anatomy is like, and self-exams should typically happen once a month.
And again, you had mentioned an MRI in addition to a mammogram. Again, who would that be? Who would that most need that?
If you have a risk of greater than 20% risk of having breast cancer, then that is when we typically recommend to add breast MRI screening.
And what else would you want people to know about breast cancer as we wrap up Breast Cancer Awareness Month?
Early detection is key. If breast cancer is caught early, as in if there's just local mass, then there's a 99% 5-year risk survival. So your chances are really great. You don't need to die from breast cancer, but don't be afraid to get screened.
All right, we are out of time, but Dr. Elizabeth Morehead with the Breast Center at St. David's Medical Center, thank you so much for sharing your time and expertise with us tonight.
Thank you so much.